So welcome to the 2022 Planetary Health Annual Meeting at Harvard University. I would now like to introduce Dr. Courtney Howard, who I hope is online, who will moderate this session on regionalizing planetary health case studies from the field. Dr. Howard is an emergency physician in Yellowknife and Canada's subarctic and a clinical associate professor in the Cummings School of Medicine at the University of Calgary. She's a nationally and globally recognized expert on the impacts of climate change on health and in the broader field on planetary health. Dr. Howard is also a member of the Planetary Health Alliance's steering committee. You can learn more about our moderators and speakers on the annual meeting website. Welcome, Dr. Howard.
So hello, everybody. I wish I could be here with you. I can't see the audience the way I usually can when I'm moderating, so I'm just going to assume you laugh at all my jokes, that you're totally entranced by the entire conversation, and that you're sitting on the edge of your seat. So please do your best to live up to my high expectations. I know our panel will not disappoint. So this is a panel about change making and change makers, and we have some real experts in leadership here. And I just want to say that Hindu Ibrahim, I had the honor at one point of watching her help lead the Indigenous Peoples Caucus at COP. And I didn't even know she was in charge, but I was reviewing my notes from the meeting a couple of weeks ago, and it said, there is a young woman who seems to be the leader here. And so I think we're in extremely good company. We've been set up extremely well to show how people can be leaders at the regional level and have those impacts really matter globally. So when I was preparing for this, I just took a look back at the 2015 Planetary Health Commission just to see what was identified as challenges at that point. So the three major challenges identified were conceptual and empathy failures, so imagination challenges, knowledge failures, and implementation failures, so failures of governance. Now, I remember when I read that, I was doing some work with the Canadian Association of Physicians for the Environment, and I remember reading that and thinking, I don't think they taught me how to do much imagining in medical school. Like, it just wasn't part of the curriculum. And governance, like, what is governance? And so we were going about making change without really knowing policy was a thing, without really knowing advocacy was a thing, without really knowing how to talk to decision makers or how to make asks, how to talk to the media. And those are all skills that are required in making change and spreading the movement of planetary health as we go. So I have been very selfish as I have structured this panel because I have done it, so I get to learn how to do all of those things better. I eventually realized that all of these skill sets are things that people actually study. And so I was honored last year to take a course from Marshall Gans at Harvard, and where you are. And his definition of leadership is, I think, something that's really worth us all taking a second to ponder. So it says, leadership means taking on the responsibility of creating conditions that enable others to achieve a shared purpose in the face of uncertainty. So that emphasis on leadership being a way of serving others and enhancing their ability. And I think that one of the best ways we can do that is in creating the types of organizational structures that we're going to hear about today. So today our panel is rich with people who have made this commitment to leadership to enable others to achieve shared purpose. I'm going to quickly go through their bios. You can read more about them online. I want to get us right into conversation. So Melvine and Anyango, I'd like you to do like boxer cheers or jazz hands when I say your name, or laugh in an embarrassed way. Melvine and Anyango is an incredible dynamic founder of the Planetary Health Eastern Africa Hub. She's a PHA Senior Next Generation Fellow, and she's an associate team member of Women Leaders for Planetary Health. And I saw you on Twitter there presenting with Maria Nera last week at the World Health Assembly. Well done.
Thank you,
Melvine. Antonia Saraiva is the lead of Planetary Health Brazil, a member of the PHA steering committee. You may remember him from having been a real huge factor in last year's conference, a faculty member at the Institute of Advanced Studies and at the School of Engineering at the University of Sao Paulo in Brazil. Let's give it up for our leader, Antonio. Yeah. Sandeep. Maharaj is a pharmacist, a global outreach fellow for the PHA. So he's someone who's helping to convene and cross-fertilize these hubs, spreading best practices. He's finishing his PhD on development of a contextual framework for healthcare sustainabilities and has his home roots in Trinidad and Tobago. Donald Wilson is the director of the Fiji Pacific Health Research and Associate Professor of Epidemiology. Who's Donald? Donald, are you waving? Am I missing you? Yay! Hi, Donald. We haven't met before. Pleasure to meet you online. He is at Fiji National University. Renzo Guinto. Hi, Renzo. How are you? So I was reading Renzo's bio, and I was like, Renzo's been totally slacking during the pandemic. Like, Renzo, I learned how to make sourdough bread, and so like, if you ever want to learn how to achieve, we could have a Skype session, because all he's done is become the lead of the PHA South and Southeast Asia Regional Hub. He's the Chief Planetary Health Scientist at the Sunway Center for Planetary Health in Malaysia. He's the Director of the Planetary and Global Health Program at St. Luke's Center College of Medicine in the Philippines. Just totally lighting it up in Asia. Well done, Renzo. But I mean, I can still teach you how to make sourdough. and finally, we have Arnau Bassa, who is the chairman of the European Network of Environment and Sustainable Development Advisory Councils and the director of the Advisory Council for the Sustainable Development of Catalonia. He has a background in public management and European studies and can really help us to understand what it means to be expanding into new hubs, not only regionally, but also into the business environment. So what I'd like to start off with is a question for everybody, and let's go in the order that we have done the introductions. If you can remember, I can help you out. And what I'm really looking for here are stories, real nuggets of things that you're excited about or things that you've done, because I find that sometimes what we fail to acknowledge as we put up our shiny new project is that getting there was kind of hard and it was scary, and we had to be the lonely voice in a room standing up to make change. So I want us to really be conscious of the fact that when we're here, we're in a community where we can share those pearls and pitfalls, so that when we go back into that room, into that institution that's not moving quickly enough, that we could be like, oh yeah, Renzo said to expect this, and we can move on with that as part of our shared knowledge base. So in the order, starting with Melvine, can you tell us about a specific initiative from your regional hub that has got you really excited about the potential for putting planetary health into action in your area?
Thank you so much, Courtney, for that welcoming session. And I'm really excited to be here with you guys today. And it's such a great honor to represent the Eastern Africa region for the work we've been doing as a hub. And basically, for me, it started off with the leadership opportunity as a campus ambassador way back in 2019. And through that, we did a number of activities with the student community in my university. But I thought there was need to promote planetary health further together with the community within the region. So basically, we started off with some small activities that we really saw that was could be able for the community to engage in. So we started off with solid waste management efforts together with the student community at University of Eldoret. And that really sparked attention when we involved the policymakers and also the community at large within the small area in our campus to do an activity with. And after that workshop, it was really exciting that the community were really interested in engaging more in planetary health. Because in most cases, as youths, we have the urge to do activities related to planetary health, but we don't know how to start. So Planetary Health really gave us a platform for youth leadership with the Campus Ambassador Program. And we find out that in the process, I realized that there was need to spread the concept further in other institutions in Kenya. And then in the process, we ended up more of reaching out to other networks. And this resulted when I visited Germany. I got to connect with more people and so on. And then going back home, I was like, this is going to be a change moment for my region. So I needed to expand the planetary health to other people. So in the process, we did a brainstorm of ideas of how could we expand more of these activities within the community, and it ended up being a big thing. We started off and then in the process, pandemic happened. I remember COVID-19 was an eye-opener for us to engage more people in the process. So The most exciting activities that we've done so far is on engaging the planetary health education in institutions in the region, because we realized there is a gap in knowledge, and also we needed to come from knowledge to action. So how can we embed planetary health into educational curriculum? So we did a pilot study in support with our networks from Europe. We've worked closely with the German Climate and Health Alliance, and they've really been supportive, and also in support of Women Leaders for Planetary Health. And we got a small grant with the DAD, and in that we started off with lecture series, and in the process we realized that there is just need to expand more of this planetary health education across the institution. And right now we are sort of coming up with a toolbox for resources, focusing more on how we could have more of planetary health embedded in different institutions. Thank you.
Wonderful. Thank you so much, Melvin. What I really loved about that was how you said, and it ended up being a big thing, that you started on a path and you met some people that resulted in getting connected with other people, resources starting. And I think sometimes when we see someone like Melvin up on stage, it can feel overwhelming. Like, how did she achieve all of that? Did you know all of that was going to happen when you sent your first email, Melvin?
No, I didn't know about it, but when I finished the Campus Ambassador program, I wrote a theory of change, like what should I do in the next coming 5 years in this planetary health space. So we sort of leveraged the networks that we had, and then also the projects that we're doing, we saw that there was need for community building aspect. We needed to strengthen the research in institutions and so on, you know. So at the end of the day, we sort of started reaching out to more people, and also in the process, we ended up forming our website, and in the process, we find out people started reaching out to us from different universities or different local NGOs who are really interested in our work. And this has been successful also with the team that we have, and this team is just made of young people, both from East Africa and the support from Europe, especially German counterparts. Thank you.
That's so incredible, and it's so wonderful to hear how different parts of the network are supporting you. Okay, now I want to hear from Antonio Saraiva, who must be celebrating an election, I'm guessing.
Yes.
Are you feeling happy? All the people in my class were extremely happy this week. So tell us what you're most excited about in Brazil.
Yeah, of course, I'm happy about the result of the elections, although I anticipate it's going to be very tough for years ahead. Not only for us, but I mean, it seems that it's something that's happening everywhere, right? So anyway, we're here to fight. So again, I'm happy to be here and to be with my colleagues and with you over there. Many things that I would like to share with you, they have to do either with the Latin America hub as well, as a whole, but also some of them more focused on Brazil, because, you know, Brazil is a region in itself. And we'd like to expand something that we're doing in Brazil to the whole Latin American colleagues, if that makes sense. Of course, we had a lot of work with the FAM 2021 last year. That was a huge accomplishment of our group, I understand. But mostly, I think that one important thing was to draw on the Campus Ambassador here, and we had our own Campus Ambassador program. This is the second year, and it was a huge success. On the first year, we had more than 360 applicants, mostly from Brazil, but there was some people from Latin America, although it was all written in Portuguese, but you know, Portuguese and Spanish, some people get along pretty well with that. In the second year, we had more than 100 applicants as well, because the time frame for submission was, for applications were shortened. And so I think this is a very important aspect that we have been investing in. I think is a way forward, because we need to invest in youth, as you said, give them then the conditions to act. That's leadership in terms of how our group is understanding that. We want them to have the voice, them to operate, because they have the energy, because they're not only the future, they're the present as well. And they're responding wonderfully. So in terms of communication, in terms of provoking us or starting new activities in every sense, not only communication. So the Planetary Health in Brazil, Campus Ambassador has been a huge success. And I would like to thank Tatiana and Raquel, which are here, and Nilsaid, because they have been the ones, and by the way, not by chance, the 3 women, so. And just to be short, to allow us to speak, also we have been interacting a lot with the Lancet Countdown in South America. I think it's another very good opportunity for us to interact in the region, and based on that, to work together. So I think these would be 2 very important things I'd like to highlight, and I can talk more later.
That's wonderful. Thank you so much, Antonio. What I love there is how you talked about creating the conditions for youth to act. I sometimes feel like we really pass the buck. We say the youth will save us, and that's not okay. There are good types of handover in emergency situations, and there are a lot less good types of handover in emergency situations. And what you're describing to us is creating the structures, enabling the skills and the connections that are required for, I think, that reverse mentorship that Robin Stott, who's part of the climate change and health movement, talks about so much, that injection of new eyes and energy into those of us who have been doing this for a while, and the connections and the access to power in institutions that we can help give to youth and help them access so that we can all achieve more together. I'm really happy to hear that the Campus Ambassador program has been so successful, and I'm not surprised. Okay, Sandeep, Maharaj, you tell us what you are most, he's just sitting there like, look what I have brought.
Yeah. So, thanks very much, and happy to be here, Courtney, and to be with you guys. No, I think one of the things that we have learned a lot in the Caribbean Hub is we need to utilize existing networks. And that's what has propelled us significantly. You follow where the passion is, and you follow where those networks are, and when you start bringing those together and coordinating, they really make you move forward I'll say, fairly quickly. The one thing that we were lucky to have was a fairly robust end of a One Health project, and persons who were looking for where's the next place that we go with this. And we were able to integrate some of that into the Caribbean Hub. Obviously, we know there are significant differences between One Health and Planetary Health, but in doing that, we were able to really move a community forward and get it. One of the issues, though, however, that we continue to face is how do we move that passion into the community? So it's still very much universities-led, and it's getting into the practice side of things is now what we require, and it's still also very health-led. So, how do we bridge those silos and get other persons involved? So, from the initial stages, I won't say there's failure, I won't say there's success, but there is a pathway now that is being charted where we can utilize some strengths, and most importantly, when there's passion, resources don't really become an issue. They just find themselves there, and what you have to do is find a way to sometimes corral the passion, or sometimes find a way to ensure that persons who are very passionate don't feel down because you're not moving as fast as they want, because some of these things require fundamental change in the way things are done, and fundamental change takes time. And that's really some of the things that I'll tell you, don't get frustrated with that. And the key nugget, and there are many other speakers, is really and truly to try and see where you can utilize what exists and leverage upon that to build going forward.
Wonderful. That is great. I'm going to quote you, find a way to corral the passion. I think that's really the key. I think that's so wise. And I loved how you were talking about working with One Health. Every once in a while when I'm in a community and we're merging with another community and people's backs are getting up because of positioning or funding or whatever, I always ask myself, what would the fossil fuel companies want me to do?
Mm-hmm. Yep.
And I find the answer is really clear. It just makes things really, really clear. So I'm really happy you're finding ways forward to harness the passion in both communities and the knowledge. So I would like to ask Donald Wilson. Don, tell us what's happening in Oceania.
Thanks, Courtney. And if I could just acknowledge again the organizers of the meeting for inviting me to join this meeting. So PHA Oceania started, I think, after the Planetary Forum in 2018. And then COVID happened. But we had 2 meetings in 2021. And of the several decisions that were made, a few that I think stood out included the importance of including indigenous leadership, indigenous perspectives, and indigenous participation. In addition to leveraging the, like Sandeep said, the networks that are existent, and being conscious of changes in social and the ecological spaces and how they impact on health. And so from PHA Oceania, I think the specific initiative that you're asking about, I'd take the example of what's happening in Fiji. So just very quickly, I engaged with PHA Oceania from my role in the Fiji Institute of Pacific Health Research, and there are 2 projects that are multi-partnered that we're currently engaged in. One is the RISE project, for lack of many other acronyms, and this is based in informal settlements. And the basis being that we know that informal settlements have informal supplies of drinking water. There's always a fecal contamination of drinking water, and so the prevalence of diarrhea in under 5 age group is quite high. So that's in the informal settlement. The second project is called the WISH project, and it's watershed interventions for systems health. So getting people, communities, and this is based in rural communities, and getting them to take ownership of maintaining, of how they can keep their watersheds clean. Simple things like animal husbandry and creating water management committees, for instance, and them taking ownership of that. But that includes, I was intrigued by, for instance, the science of, because there was some genomics and sequencing work that was involved, collecting samples from the high mountains and following and tracking, because there was also geolocation of samples that was included, tracking how one Salmonella typhi gene migrated and being able to overlay that with when landslides happened, with when flooding happened. So it was really interesting when we were giving this advice to the people in the communities and telling them that, you see, it's because of landslides. Also, when you have landslides, not just flooding, that after landslides as well, you can have an increase in the incidence of typhoid, for instance. And so getting people to take ownership of the watersheds, looking after that, ensuring that animals are not, coming around there, and building or reinforcing their watersheds. And in the informal settlements, is just looking at how people, this was trying to get septic water and using wetland practices within these built informal settlements and treating them with plants rather than chemicals, but just ensuring that the water that comes out of there can be redistributed in the community, not to drink, but just to go back into the environment. So with those 2 projects, we've now been able to recently get funding to use the findings from these studies to take them to 2 countries in the Pacific. So what we're trying to build now is on a dream that we're calling Tandra Vanua. Vanua means land, but Vanua is a word that's also used in other parts of the Pacific region. Whenua in New Zealand, in the Maori language, in the Cook Islands, in the other languages in the Pacific. But it's referring to the indigenous ownership. And Tandra means dream in Fijian. So we're using that to create a regional research hub that we're hoping can use these learnings from the networks that we already have to move the concept of planetary health across the Pacific.
Wonderful. I'm so happy to hear the involvement of Indigenous thought. I've been serving a majority Indigenous population for over a decade now, and I have learned as much about planetary health from Elder Francois Paulette and Nicole Redvers, who I think is there, and other patients, as I have from reading all the really smart things that everybody in that room and online has written. I feel incredibly lucky to live in a place that has these experts with this really deep knowledge of the land and ways of being. And it sounds as though you also are really benefiting from that traditional knowledge and land-based wisdom. And I mean, what's more important than water? Nothing. All right, Renzo, underachiever, you tell us what you're most excited about. What of all the things you've done are you most excited about right now?
Sure, thank you, Courtney. And let me begin by first acknowledging I'm feeling a bit nostalgic right now, because maybe some of you are aware that the first ever Planetary Health Alliance conference started in this room in 2017. I was here as a young doctoral student at Harvard here, and a few years later, we're now back with 6 regional leads reporting about what's happening in the regions. Because during that time, the concept of the regional hub was not even existing. So, you know, we have grown as a community, and I think we should be very proud of it, but also it's a challenge, how we can further expand our work so that we can all reach all regions and all corners of the world. And going back to that young Renzo who was in this room a few years back, you know, when I was, starting my planetary health journey, I was involved in helping build the young network, the youth network that now Melvine is a very active member of. During that time, it was already very clear to me that after my doctoral studies, I'll return to the Philippines, my home country. I'll return to Southeast Asia because that is where the planetary health work needs to be done. And so I'm very happy and proud to report to you in this convening that after 2 years of being in the middle of a pandemic and while fighting a pandemic, in our hub, the regional hub of South and Southeast Asia, we were able to establish not just 1, but 2 centers for planetary health. One in the Philippines at the St. Luke's Medical Center. I'm very proud that one of my research fellows, Crisel Penamante, is here. And also another one in Malaysia, of course. We have Jamila Mahmood and my teammates also here. You'll hear more about the story of the Sunway Center later on when Jamila speaks. We have established a national network called Planetary Health Philippines, PH². Visit our website, planetaryhealth.ph. That's a lot of PH, right? And in Malaysia, we have a government that is now developing a national planetary health action plan, among others. And then in our neighboring countries, you have Singapore in its medical school also building a planetary health program. And then you go to India and Bangladesh, you also have other institutions now establishing their planetary health units, programs, centers. So it's a very exciting time for planetary health in our region. And of course, I just want to acknowledge, because we don't have a representative here from the East Asia Hub, and we have our colleagues from Nagasaki and Hiroshima University, and also Professor Nakamura, are you here? Who are also leading planetary health in Japan. And so, amazing. And we'll definitely work together because, Asia is really vast and we have diverse challenges, but also we have shared, values and principles. And, let's maximize, our cultural connections in terms of addressing these shared planetary health problems. So that's what's happening in our region. And moving forward, what's other exciting stuff will be happening? A few weeks ago, we just had our Southeast Asia and South Asia convening. And thanks to Jeremy for staying up late until 1 a.m. to join us in the other side of the world. And there are 3 major things that our members, which, we have around 30 members in the region, and which is growing, 3 main things that have been identified. And there are more. Number 1, we want to lead a planetary health education revolution in our region. And we want to make sure that our educational programs are, global in perspective, but, contextualized and culturally appropriate, bringing in, Asian philosophies and traditions, Confucianism, Buddhism, Islam. 2 years ago, we wrote an article on the contributions of Islam to planetary health. The second one is more knowledge exchange, good practices on education, on how to influence governments to become more planetary health oriented. We want to make sure that there is a seamless transfer of knowledge among the members of a regional hub. And finally, unfortunately, a few days ago, the Philippines, my home country, was struck again by a major typhoon claiming more than 100 lives and counting. And This is not a unique reality for the Philippines. Many countries in the region already experiencing these extreme weather events related to the climate emergency. And so we're thinking of something around sharing of resilience initiatives so that we can actually build the resilience of communities who are in the front lines of these planetary health challenges. I'll stop there. Thanks.
Well, that's incredible as always, Renzo. And I know you know a lot, and I know you've read a lot of papers and written a lot of papers, but I'm always struck by your energy and your positive can-do spirit. And I have a feeling that that's had as much to do with what you've achieved in the last couple of years as all those papers you've read and written. And so just thinking about how we show up in this space. I have never been with Renzo in a space where he didn't show up absolutely fully ready and present. And I think that that's something we can really learn from. All right, I am now going to go to Arnau Bassa. Please tell us how things are going, where you are, and in the circles in which you run.
Yeah. Hello. Do you hear me? Yeah. Can you hear me?
Yes.
Okay, perfect. So thank you for the invitation. I'm sorry, but I couldn't travel to Boston. But I really appreciate the invitation. And I think that in order to start, I think that there are two key words here, which are energy and passion. I mean, I think that if we need to talk about planetary health, we need to talk about energy and passion, and we need passionate people, as we have here in the stage. So in Europe, not only in the European Union, because the European Hub also includes members from, let's say, non-EU member states. So our hub is extremely new. We started in January 2022 with the first online convening. And after several online meetings, we had a first in-person convening in Amsterdam in September. And then, I think it was 25th of September in Amsterdam, in Artis. And it was, for me, was really, really stimulating to see how many people from 12 European countries coming from the educational world, the research community, let's say the social movements, but also some institutions linked to, let's say, public administration, think tanks, were ready to share their visions, ready to share information, but also to share efforts with this passion, with this energy that I mentioned before, in order to create for the first time a planetary health community in Europe. What we realized there in January is that in Europe we have a lot of organizations just working on pH from different perspectives, but together with the Planetary Health Alliance, the EAC network and the PHA decided that it was important to create a space for joint activity, for looking for synergies, for, a platform that would allow all our members, all the members, to better improve the way they work, they operate. And at the end, it's a very diverse group of people benefiting from the different perspectives we have. You know, we councils advise governments and parliaments, but we have also, for instance, IS Global, based in Barcelona, who works on research and education and training. We have health organizations just looking for, let's say, platforms that where they can transfer through the information they have from the research to the society and to policymakers. So we are here. We are at this point. We have prepared after the Amsterdam convening. We have prepared a concept note, which is not only a paper. It's more than this. Is let's say, is a document where we have put all our aspirations, We have also put there the, let's say, initial working plan, and then we are now going for, we are just we want to establish a secretariat that will allow us to better cope between all the organizations. And what I would like to also explain you that we work on the basis of 4 working groups, one on education, another one on, let's say, on policy making, how we reach policymakers, how we advocate. Then we have also a working group on research, which is really very active, and another one on movement building. So here, the most important thing is to realize that although we work on the basis of these groups, all these groups need to work together because PH requires a systemic vision, and we need to find a way to go out, to move out from our silos in order to work together with energy and passion. And finally, and for me it's a very important point, we have more than 72 organizations from these 12 countries ready to work. So it's not bad for as a starting point for the hub. So thank you.
Yeah, that's wonderful. And you know what I loved about that is we went from energy and passion to secretariats. I didn't know what a secretariat was for the longest time. I'm an emergency doctor, and people like Renzo, who are part of the International Federation of Medical Students Association, and people who are part of the World Medical Association were talking about secretariats, and I was like, what's a secretariat? And I have come to love secretariats and to see how something that has as frankly boring a name as a secretariat is so important to corralling the energy and the passion, as several people have mentioned here. I mean, do we need a new word for it? Like, how do we communicate just how sexy a secretariat is? Because, you know, sometimes nothing happens until someone's willing to set up the teleconference. And, you know, that kind of structure is just so important. And really valuing those structures, making sure that our institutions make space for those structures, that resources are directed to those structures, so that it's not a project that's happening on the side of the desk of 3 people who are already doing 1.5 jobs. Doctors tend to disappear into the emergency department of the hospital for ages, and then things get dropped. Let's celebrate Secretariat. So how about we just take a second to celebrate the Planetary Health Alliance Secretariat for putting this whole thing on right now. So I'd like to go to sort of a quick pop around, and then, and I didn't tell the panelists I was going to do this, once we all answer this question, I'm going to ask you to ask one of the other panelists, like a burning question that will help you advance your own learning. Like, how did you do that? What happened? How did you get that to go? So just start thinking about that as we're going. Okay, so this is a little bit of a Brene Brown vulnerability moment. Are we ready?
Yeah.
Great.
Yes.
So what is the scariest thing that you've done that you're really, really glad you did? Like the cold calling of someone, the asking for money, the just showing up somewhere that you weren't invited. What was it? The standing up in a room where people didn't seem to want to know what you had to say. What was the scariest thing that you've done that you're just like, you look back and you're like, wow, I'm so glad I got up that day and just mustered the courage to do that. Melvin?
Okay, thank you so much. One of the scariest moments was now being young in this space. I was like, how am I going to get the support to start like these activities in terms of finances? So I took a bold step and reached out to Nicole De Paula, the founder of Women Leaders for Planetary Health, and Kim. And they were really very, very supportive, and they connected me to somebody who was really interested in the Eastern African region, that is Dr. Martin Herman, who really were there to support the movement and to nurture me like in terms of also leadership and how to take the hub in the next steps. And in the process, it ended up like us applying for a small grant with the DAD to to support the initiative. And in the process, we started receiving more grants again for another activities, those short-term. And right now, I'm just glad that we have a 4-year project, but that is strengthening One Health and Planetary Health in East Africa. So the step that I took, which was really scary, approaching them that I needed help, as in like, I have this, as in we are building this movement, but I don't know what to do in terms of getting finances to support the activities that we were thinking about to do.
Well done. You know, that is a scary thing, to reach out to someone that you know is a leader and then to ask for money. I think asking for money is like, that's the thing that still makes me like, oh, maybe I'll go, maybe I'll make dinner today or play with my children. So, you know, well done. And look what you've created. And, you know, just that courage and taking that step. Wow. Like it's amazing how when we muster that courage and we have those moments of vulnerability that so many things come to life. Okay, Antonio.
I'm feeling nostalgic, right, like him, thinking of the young Antonio 5 years ago. I had to do it, sorry. I think the scariest thing, I think, it was to go ahead with last year's event online. Because, you know, we didn't know how, if we would be able to make it in person, and so with PHA we decided to go online, and then all those decisions make it a full week. You know what happened, and so that was scary. It was crazy. It ended up well, but I think we were about to lose control at the very end, and I told Marie about that. So, but it went well. But going back nostalgically, I think that one scary story was when I first got in contact with the Lancet report in 2015, and I was at that time the executive director of the Commission on Biodiversity on Biological Diversity was a Brazilian, and he asked me to launch the report in Brazil, and we did that at USB. And at that time when I was the one to do that, so what do I have to do with that? Planetary Health, I'm an engineer. What do I have to do with that? So the scary thing at that time was to get in contact and read the report, and then from that on, I saw that this is about health, yes, but it's not only about health related people. So that scary moment on being involved in how to bring that to the university, to Brazil, after I read that, I said to myself, this is where I want to work from now on. So the fear that I had at the first moment, and then trying to bring that, turned into, well, that's something I want to do from now on, from my son, from the other people, because I believe in this. So it quickly turned into a lot of energy. So.
Yeah, no, those are wonderful, wonderful examples. And I've been sort of there for part of those journeys. And I've watched you on the teleconference sort of with slightly wide eyes commit to the crazy big thing and then do it. And even if it is at the edge of your capabilities and you have to at the last minute bring in new people to help, it happened, it worked, you did it. And we're all here. Largely, you know, this community was convened so strongly by you through the pandemic, and that really mattered. So we're here partly because of those efforts. Okay, Sandeep, please tell us, what's your scary thing?
You asked what was very scary with Planetary Health. In fact, my first interaction with Planetary Health was just when I finished my PhD, 2016, looking at sustainable health systems. And the Lancet Commission report came out. And just as I walked in the university, they gave me a research group of students. And I said, medical students, we're gonna do a research to find out what do directors of Masters of Public Health programs understand on planetary health. We went out there. But I knew nothing about it, right? So I'm asking people what they know about it. And all I did, I read this commission. And trying to find out exactly, and I'm very grateful, I wrote to Martin McKee. And I was never expecting Martin to respond. And Martin did respond. And he was very, very helpful in actually guiding the students and myself to understand planetary health. And a few days later, I was on a plane up to Boston to attend the conference here. And Sam did some fantastic work. And hearing the impact of carbon pressures and so on food and nutrition, that stuck with me. Went straight back, wrote to every vice chancellor of a national university in the Caribbean, and all of them agreed, yes, we need to jump on board with you. We are going to start finding a way. And that's how the first hub in the Caribbean started. And it was really, I'll tell you, it was frightening to write to them, but I felt empowered given the level of work that was done by the commission as well as coming out of the first conference. So that's my story there in a nutshell. Thanks.
I love it. I have so often felt lonely doing a job and found strength and power and solidarity in almost virtually holding hands with people who have given me energy on the other side of the world, either through their example or their friendship or their teaching. And so I'm so glad to hear that this network is already providing that for you. It's just really, really wonderful to hear. Dawn, we've only just met, but I still want you to tell me about the scariest thing you've ever done that you're really glad you've done, Dawn.
Fiji is a little country in the South Pacific. We have a population of close to 1 million. We still have leptospirosis, typhoid, and dengue and diarrheal diseases problems that affect people, and especially children under 5. When COVID hit last year, at the peak of COVID, so you know how every evening on the news you'll have the Secretary of Health announcing what the numbers were, how many tests were done. There was a time when Fiji was number 4 on the infectivity rate, on the test positivity rate in the world. And that was the load of cases that we were getting, and our hospitals were getting overwhelmed. And at one stage, when the Secretary of Health was presenting, he'd say, so we were able to do 20,000 tests today, but we needed to send 10,000 samples to Melbourne because our laboratories could not manage the load. And so I realized 2 things. One, as a national university, we were not supporting the government system in that space. We could not provide it. We couldn't provide that service because we had the people, we didn't have the infrastructure. And this is where the drive for this regional research hub is also. Secondly, we had not invested much in research in infectious diseases or communicable diseases, although we continued to have the burden of those, particularly leptospirosis, typhoid, and dengue. And so I sent a grant proposal to the Australian government, and we got funded. And we're starting off with a container laboratory, about $500,000. And so at least we're getting a container that's fitted with equipment. We'll start doing a number of studies that are COVID-related. But that was, I couldn't believe that actually happened. But it was something I think that was well justified and that we were contributing to national capacity building. Yeah.
I love these stories. I think a lot of these stories could be summed up with pushing your luck.
It is.
Because you never know, sometimes it works. And like that's incredible. You know, there's so many times that I end up feeling that way. All right, Renzo, what's the moment that you really felt vulnerable and you did the thing anyway and you're so happy you did?
Sure, let me give you a rundown. So first, it's scary to be returning to the Philippines after studying here, you know, and hoping and excited to spread the virus of planetary health to Southeast Asia, only to find out there's another virus already about to spread. Of course, we know what it is. And, you know, I thought that, oh, my planetary health dreams are over because everyone now is on COVID mode. You know, that was the situation. But, and I was actually afraid that, you know, St. Luke's, for example, in the Philippines will withdraw, you know, from this idea of building a planetary health program in the country. Of course, you know, thankfully it happened. And what else is scary, or was scary? You know, I alluded to the COVIDization of everything, basically. And it was quite, you know, anxiety creating, to be communicating about planetary health while everybody's talking about COVID, right? And I think it was quite challenging because, I think during that time you were seen as, oh, he's talking about something else, climate change, issues for tomorrow, we're dealing with a crisis now. So that was quite challenging, and I'm sure many people in this room can resonate, trying to communicate about planetary health while we are in the middle of another global health crisis. What is scaring me at the moment? Two things. Number one, planetary health is, if we count our history, our young history, and trace our young history from the publication of the Lancet report, we're like around 7, 8 years old, right? And I think now people, different stakeholders, especially the policy and practice world, they're now asking, how can the planetary health concept truly make a real world and lasting impact on the world? So now, we're very good diagnosticians in planetary health. We know the problems very much. Yesterday we talked about all the problems that are confronting planetary health around the world. But I think now we need to move fast to this phase of coming up with solutions that will really tackle planetary health challenges and transform, and enable that great transformation that we in the planetary health community have been advocating for, embedded in the Sao Paulo Declaration on Planetary Health. So I think that's one thing that I'm becoming a bit scared about. When you're asked those hard questions, okay, we understand the problem, the planetary health concept resonates with us, but what is the solution? And can we do it? Can we implement it right away? I hope we're starting to think around, that challenge. And then the other is, I think, regarding communicating planetary health to different audiences. Especially to the One Health crowd. Sometimes it scares me when you're talking about planetary health to all these different academic communities. So what I did is I just joined the Lancet One Health Commission as a planetary health representative, and now we're having some good discussions. Hopefully there'll be more opportunities, for us to focus on the commonalities and the synergies rather than our differences that emanate from our academic, disciplinary origins. We know One Health, Planetary Health, Eco-Health, Geo-Health, all this health. They're coming from different corners of the academic world. But I think we're all looking at the same elephant, but through different angles. We just want healthy people, healthy planet, healthy animals and plants. So this is something that is, quite scary sometimes. But I think as we, communicate more and practice and learn by doing, we can find those common ground with these different communities. I'll stop there.
Yeah, I 100% agree, Renzo, in having those sometimes scary conversations with somebody that you think may kind of have a bit of a different point of view, who may have a different stake, and just taking the time to build those links of trust and relationship that allow you to send the email to prevent tension, and also send the email in case there is tension, and to resolve it on a really human, personal level. I really agree with you in terms of solutions. I'm here at the Blavatnik School of Government at Oxford, taking their public policy masters because of that. And I went around the first day and asked who was there. There's not a single biologic science person in my policy class. There's like 1 million lawyers, a couple doctors, some engineers, and I'm like, you guys are one of the preeminent policy and government places in the world. Like, where are all the scientists? So if we want to be good at this, there's people who teach you how to do it. And I think sometimes we need to put ourselves in those spaces. Okay, I'm really interested, Arnau, tell us, you've just done a lot of really new things. So which part of those was scary that you're really glad that you did?
I'm not scared about anything, although the difficulties that we have in order to convince policymakers and society about the importance of material health. We know, you can read the newspapers, you can see in the TV, but especially, you can read in the scientific report how the world, the planet is following a totally unsustainable path. And this is scary. Yes, this is the most scary thing. And then when you cannot offer a good future to young generations, this is the most scaring situation or challenge I've ever faced. And this is the situation that we face now when I meet young people, and I must say them, people, you are part of the solution. We need you, the planet needs you and your energy and your passion. However, your future and our future will be absolutely different as you and as we expected some years ago, at least when we were young, or as young as you are now. Having said this, and for me, this is the most difficult point, and this is the most difficult thing, or the most difficult situation when you need to transmit some hope to young generations when you know that the future is not as brilliant as it should be. Having said this, two small scary moments from a personal point of view, and it's not, I mean, having said this, anything is really scary. But I remember when some years ago, during the pandemics, the first year of the pandemics, I live in a very small village, let's say very small, it has 8,000 inhabitants. And the local television came to some people in the local television asked me to prepare an interview, an online program. Well, fantastic. I said, yes, I will help you. So we are going to talk about, on my neighbors, about climate change, about energy transition, about planetary health. And, you know, starting from nothing, then I invited, for instance, Jure Marianto from IS Global. So a lot of, let's say, incredible scientists came to the program in the virtual mode in order to share their knowledge to normal people without any knowledge about climate change, etc. But, you know, for me, being the one just organizing a platform for a change with people that didn't know anything about these topics was scary. And the other point, I must confess that one of the scaring points is in the preparation of 3 webinars that the EIC network and my council organized on planetary health in 2020, I think it was, yeah, 2021, I get it. The first, I sat with my team and the question came. And the question was obviously, and I was scared at that moment, are you sure that you want to talk about planetary health or One Health or ecological health or environmental health? So come on, we are talking about the same point. But at this moment, I knew that according to the approach that I gave to these webinars, I would have some organizations on board and some others saying no, because we are against working on silos. And it was not a very scary thing compared with the global situation, but from a very practical point of view, I got nervous, let's say. Thank you.
Yes, thank you. And, you know, thank you for reminding us that the situation itself is scary. Certainly, we all have moments where the new report comes out and we think to ourselves, oh my gosh, you know, look at where we are. And to know that those feelings are entirely normal, that is a normal response to a real threat. And to allow ourselves the time and the energy and the time in nature and with our friends and family and sleeping, to give ourselves the energy we need to show up in these spaces with the energy and the passion and the ability to interact and listen well and have those really thoughtful conversations with one another. Well, we're definitely too close for me to ask another round of questions, so I'm going to leave you to the coffee breaks to ask one another your burning question about what you really want to know about how someone did something, and I'll let the audience ask you those as well. So I'm going to go away from this knowing and really thinking a lot about what I've learned from you today. So those kinds of things are pushing your luck. Don't be afraid to send that email to that powerful person who might not respond. They might not. And you know what, if they don't, maybe they're just busy, nothing personal. Try them again. And meanwhile, they might actually answer. Ask for the money. We need the money to build the really swish secretariats. They're going to help us to marshal that energy and that passion. And what I love is just so many stories already of how the momentum's building, how this relationship led to that relationship, led to that resource, led to this network, led to us being able to create the conditions for others to contribute, to do those types of leadership that really provides the space and the forum for people to contribute what they can at this moment in time. And you know, it is scary. We're at this moment of overlapping challenge. We're seeing biodiversity crises, climate crises, the ongoing COVID. The world feels very unstable. But the thing about instability is that it means that a lot of change is possible. So we have this entirely new frame to bring into Western thought that's already been part of so many land-based indigenous thought practices and other thought practices. We have this moment, we have a message at a moment of instability. The potential for change is incredible. And I know sometimes it can feel a bit scary to be at this moment in time, but at the same time, how many people in the history of the world have had the opportunity to bring their skills to bear on a moment to have a huge impact on health, not only now, but for all future generations. It's an incredible community at an incredible moment. Thank you so much for sharing your stories and your learnings and your moments of vulnerability and success with us today. And I can't wait to see what we're going to accomplish in the years to come for the next time that we come and convene in that lecture hall at Harvard.
Thank you, Courtney. And I just want to say I'm honored to work with everyone up here on stage and that we're on Zoom, and excited to keep working with you all, and that this session was just very inspiring. So one last round of applause, please. In a moment, we'll have a break, but before we do, we have a brief announcement for a Planetary Health opportunity from Matthew Cavallo.
Hi, everyone. I hope your day is going well so far. My name is Matthew Cavallo, and I'm here representing Georgetown University's newly founded School of Health in Washington, D.C. As I'm sure many of you are aware, the CUGH, Consortium of Universities for Global Health Conference, is having their annual meeting next April in Washington, D.C., and the Georgetown School of Health is actually going to be coordinating a satellite session for the conference between health experts and practicing diplomats to see the future of global, but more importantly, planetary health diplomacy, what it will look like, and creating a forum for experts in the health field to work with experts in international relations on how to best build a planetary health mentality on the diplomatic stage. Multiple embassies will be participating, as well as health and diplomatic experts from across the world. We are hoping to host this satellite session in a hybrid format, entirely free for both virtual and in-person participants. And if any of you would like to help or help coordinate in any regard, please come find me outside, as we would love to have your support. Thank you.